We were obviously disappointed with our rating.
Dr. McKay is the medical director of quality at Munson. He's referring to the low rating the hospital was given by Consumer Reports for surgery because of prolonged length of stay. Consumer Reports says they looked at nearly 100 common surgical procedures and based the ratings on how many people died or stayed longer than expected after surgery. The hospital's CEO says Consumer Reports is oversimplifying the report by only looking at these two factors.
All of our internal data, and frankly Medicare data, would say that our complications and outcomes in surgery is better than expected. And so we're not quite sure the details of how they came up with some of their methodology.
We spoke with Doris Peter, the Associate Director of Consumer Reports Health Rating Center, who says she disagrees that the analysis is oversimplified because she says they didn't focus on the average length of a patient's time in the hospital, but cases where patients were there longer than expected.
They're really the length of stay outliers. They're not just, prolonged by a day or two. They're really outliers compared to that hospital's mean. So indicating that something, went wrong, and sure there are cases other than, actual postoperative complications that can cause increased length of stay.
Munson's CEO says they would rather a patient stay longer in the hospital and be ready to go home than be rehospitalized later. He says the average patient stays about 4.5 days in the hospital after surgery.
We're in a rural area, and so if a patient lives in Gaylord or Alpena, we want to be careful about sending them home until they're ready.
Sure, our analysis of our own research shows that rural hospitals actually do better than urban hospitals, or on average. So that's another thing that would suggest that that's not the issue.
Despite their findings, Consumer Reports says this report shows only one aspect of the hospital's performance.
This hospital that you're referring to has a pretty high safety score, which is looking more broadly at what happens in the hospital. So, for example, they get our second highest rating in bloodstream infections. That's a really good rating for that.
Both Munson and Consumer Reports agree there needs to be more comprehensive information for patients to make informed decisions about where to go for health care.
The one good that came out of this is Consumer Reports made people maybe realize that there is information out there, maybe better information or at least more comprehensive. And now we have to direct them as to how to find it. But this will continue to evolve over time.
I think we need to have all the data out there so we can compare it and come up with the best method.